Let's take a look at an animation. We're going to focus in on the foot. We know that slight motion occurring throughout the joints is normal. The soft tissues are able to handle that. But when we have excessive abnormal forces acting throughout the foot, deformities will occur. Here's the sinus tarsi. When we have obliteration of the sinus tarsi, this will then lead to these excessive forces, which are going to act on the soft tissue and bony structures of the hindfoot, midfoot, and forefoot. What we also know is that when we have obliteration of the sinus tarsi, this then leads to excessive motion, causing deformities to the knee, hip, pelvis, back, neck, and even TMJ problems have all been contributed to excessive rear foot motion or hyperpronation. Here's the HyProCure sinus tarsi stent, the solution to the problem. We have the threads which locks into the talocalcaneal interosseous ligament to help prevent the implant from backing out. The tapered portion allows for accurate placement within the sinus tarsi and prevents overinsertion. The outer part also allows for the prevention of the obliteration of the sinus tarsi. And we have another groove for further fibrotic tissue on-growth onto the implant to prevent displacement. Our stents are also cannulated for guide wire insertion. The HyProCure sinus tarsi stents are made of medical grade titanium, so they are extremely compatible with the body and do not wear out. Here we can take a look at the placement of the HyProCure stent on the calcaneus. It's going to sit into the floor of both the sinus and the canalis portions of the sinus tarsi, the only implant that does this. Here's also again a look at the talus with the implant in place, and the taper portion abuts the lateral aspect of the canal to prevent overinsertion. Here's the trial sizers. There's 5 different sizes in the driver. This surgery is performed as a brief outpatient surgery under twilight sedation. The landmarks are the fibular malleolus and the anterior calcaneal tubercle. A small incision is placed halfway between these 2 sites. At this point, you have to cut the interosseous talocalcaneal ligament so that the implant will get locked in. You can place a guide wire into the sinus tarsi, and we'll start with the number 6 trial sizer. No matter how severe the deformity, always start with that size. Remember to head to the posterior aspect of the medial malleolus because that's where the canal runs. You want to load the 4th and 5th metatarsal heads to see how much pronation is occurring. We want to try to get less than 4 degrees of pronation in the foot. You don't want to just evaluate the heel, but it's the whole foot. Keep inserting the different trial sizers until we have almost no pronation, and then we can back it down a size because we need to pronate. By taking it up to the point where there's minimal pronation, we know that we'll be able to size the patient correctly without overcorrecting them. So once the size is determined, we'll place the stent in the driver on the guide wire. Before the stent is fully inserted, pull the guide wire out and push the stent in till it won't go in anymore. And that's it. You should check the placement with fluoroscopy. So now that we have the stent in place, we have the normal motion of the talus on the calcaneus, and the excessive motion is eliminated, which realigns the foot as well as the knee, hip, and back. So now we don't have the excessive forces acting on the bones and soft tissue of the body. This 5-minute procedure makes a dramatic difference to the rest of the body.